To our February community conversation with LifeSpring. I'm Dustin Hawkins, the Director of Training for LifeSpring Health Systems and your moderator for today. Today, I'm joined by three panelists from LifeSpring's Child and Family Services who will be discussing the prevalence and treatment of childhood depression and anxiety. Today's panel conversation will go like this. We'll start with a question and answer series between me, the moderator, and our panelists. At about 5:40, we'll select questions from the audience for the panelists. So if you have questions for the panelists, please submit that through our comment feature on the chat feature for Google Meet. This conversation is being recorded and will be available on LifeSpring's website at a future date. I'll post a link to LifeSpring here in the chat in just a moment. After our conversation, please feel free to stick around and mingle a little bit. I'll keep this going for maybe 10 or 15 more minutes, but that portion will not be recorded. So, okay. So let's go ahead and get started with some introductions. So, Kim, why don't you go first?
Oh my gosh, I feel so lucky. My name's Kim Guessford. I am the clinical manager here at Child and Family Services program within LifeSpring. And I have been the manager since May of 2019, but I've been at LifeSpring CFS since August of 2015. Anything else that I need to introduce, or is that good?
I think that's good.
Okay, perfect.
So, Chris, how about you?
Hi, everyone. I'm Chris Rakestraw. I'm a child and family therapist here at Children and Family Services in Jeffersonville. I've actually been with the organization since October of 2000 in a couple of different roles, home-based therapist, child and family therapist, clinical manager, team leader, crisis team leader, you name it. But my passion is therapy. I really like working with children, teens, and families. So I'm really excited about being here and being able to join in this conversation.
And Whitney.
Hello, my name is Whitney Lyon. I am a psychiatric mental health nurse practitioner. I'm also certified as a family nurse practitioner, and I am our psychiatric medication management provider for Child and Family Services. I've been here for about 2 years, and I also do psychiatric medication management at the Clark County Jail via LifeSpring.
Nice. Well, thank you all for those introductions. So let's just go ahead and get started with the questioning. I want to start with just the basic information here, and I think I'll start with Kim. So what's the difference between anxiety and depression?
So if we're simplifying it a lot, and you're just wanting to get a basic understanding, depression is what I would see as someone who is maybe sad. Another kind of lesser known thing when it comes to children and adolescents is the presence of irritability and anger. So a lot of times kids come in here not because they are boo-hooing in the corner, but because they're really mad, and that can be a sign of depression. And then anxiety is when a child or, well, anyone worries a lot or has some kind of like thought process that makes them think about what ifs. And that can look a little bit different depending on the type of anxiety a kid has. Now, I will say, if someone is really worried about something, there's a really good chance that depression might pop up too. And so a lot of times they're not just mutually exclusive. So sometimes really figuring out which is which is not always clear because they overlap in symptoms. But like the basic thought process is someone who's really sad and someone who's really nervous, but that's simplifying it.
Gotcha. Would either one of our other panelists like to add on?
I would like just to add to what Kim's saying. These two, anxiety and depression, do play off of each other. And just to add on to what Kim was saying, say a child starts out with some anxiety issues and they really struggle with that. A lot of times we see depression coming along afterwards. because it really starts to impact children's self-esteem a lot, their self-confidence. And so those struggles start showing up as some depression a lot of times.
All right. Whitney, did you want to add anything to that?
No, I think they did a great job with that one.
They did. So Chris, I'll actually go with the depression where you kind of ended there. So how would one know the difference between depression, the actual diagnosis, and just, being down, being sad?
Great question. So there is a difference here in two areas in the way that I see things. For depression, it lasts longer than just having a down day. So clinically, we start looking at situations where for 2 weeks or more, the child or the teen is having a down time. And then we also look at what are the effects on the child? What's the impact here? How much does this depression or these down times interfere with their daily living? So are they starting to have trouble at home, at school, with their friends? And if they have a job, are they struggling more in those ways? Those could be some indications that it's more than just a down day.
Okay. Kim, did you have anything to add, or Whitney?
I think usually a bigger indication of this is more than just sadness or a bad day or a down day or about even a down couple days is also there's a higher chance of suicidal thoughts that could come up that would definitely switch us from just a bad day, sad day to more of possible depression, especially if those thoughts linger. And then also self-harm behaviors could also be an indication that maybe this is a little bit more than a down day, especially if it lasts more than just maybe an immediate response from a breakup or from a friendship fight or an argument with a parent. If it lingers for a little bit longer than just maybe that night, that would be when we would want to maybe explore, is there a possible clinical depression versus bad day, sad day kind of thing.
Okay. So, and anyone can answer this question here. We kind of briefly talked about it in some of our other descriptions, but are there different kinds of anxiety that we need to be aware of? And maybe how they present?
Well, when I'm talking with families that I'm working with, I simplify things because it can get very complicated. But basically, there's two basic types of anxiety. You can either have a really specific anxiety, like you're afraid of heights, you don't like closed-in places, you don't like snakes or bugs. Or you can have more of a general anxiety, and this is a situation where it's kind of like a free-floating anxiety. It's kind of vague. You might not be able to pinpoint exactly what's causing that anxiety. So thinking specific anxiety, general anxiety, and then if you want to get a little bit more detailed with it, there's a lot of different forms that anxiety takes as far as clinically what we see here at our office. General anxiety, which is the worries that Kim was talking about earlier. You can also see separation anxiety, especially in younger kids that are clinging to their parents whenever they have to be separated and having difficulty that way. Social anxiety, where folks really have a hard time being out in public sometimes and prefer to be at home because it's so anxiety producing for them. And sometimes even school avoidance. There's situations where the anxiety is so high because of the work or because of the school environment.
Would any of the other panelists like to add on?
I will say when I've had clients that have had generalized anxiety disorder, sometimes they come in and they don't even know, like they don't even know what to report to help indicate that they have anxiety. And so it does take some time at times for me to continue seeing a client for a while. And then I'll start to recognize like, oh, they have this underlying anxiety. And a lot of it's because it seems like so normal to them. They just always feel tightly wound, and they have always felt tightly wound since they were little. So that once they don't know that that's not what everybody else feels. So they'll sit here and they'll tell me things, and I'm like, yeah, that's not what everybody else always feels. And they're like, what? And so that can sometimes be an indication. And it can be kind of hard to determine at the beginning, because they may not be able to come in and go, I worry a lot about school, or I worry a lot about all these things. They just feel bad, and they just feel off, and they feel really irritable. And so it can take some time to really filter out that what this is this just basic like hum of anxiety that just exists on a daily basis. So, and I just wanted to point that out too, of like, sometimes that is really easy to determine, and sometimes it's not if they don't know how to report it.
Exactly.
I'll add on to that if I may. From a medical perspective, I often have seen kids when I've done pediatric primary care and here that come in complaining of what we call somatic symptoms. So physical symptoms that are manifesting because of anxiety. And so they've had their stomach aches worked up and their headaches worked up, and no one can find any answers. And we finally get down to the bottom of it, and that's really what it was.
True. Thank you all. So going with that, so what are some of the unique signs that a child or adolescent may be having anxiety issues? Kim, well, I'll just go ahead and start with you.
Okay. Let's talk. I'm going to talk a little bit about kids, because I think with kids being less verbal, sometimes they don't verbalize it as easily. So like a lot of times what I would look for is like skin picking can be a sign. So some kind of nervous behavior. So like skin picking, shaking their leg, biting their nails, biting the bottom of their lip can be an indicator, like picking at their skin on their lips. Somatic symptoms, just like Whitney brought up, that was a really great point, Whitney, that I didn't even think about, that we will see a lot of indications of like this kid is constantly being sick. Rumination. So rumination is kind of this repetitive thought process that just goes into a circle, and they just repeat questions. And sometimes that can be really annoying as a parent or a caregiver, because you're like, oh my gosh, I've already answered this question. But that actually can be a good indication that this is something that their kid is mulling over in their head over and over again. That can be really upsetting for them. Sleep changes, concentration changes, irritability can be a huge indication of anxiety that might be present. And then avoidant behavior. So kind of like what Chris talked about. So like school avoidance, maybe they don't go out with their friends as much as they used to because maybe something happened that they're worried about. Maybe they don't want to leave you because maybe there was a death in the family, and so now they're getting some anxiety related to that. Those are kind of the things that I think of when I think of little kids, but also teenagers too. Teenagers just sometimes can verbalize the I worry about this better than the little kids can.
Great, thank you. Would anyone like
So-
to? Yeah, go ahead, Chris.
Yeah, Dustin, with the anxiety with teenagers, sometimes we see that more as irritability sometimes. And this is where it sometimes gets to be hard to distinguish between anxiety and depression, because they both can show as irritability. Also, teens will tell me that they overthink a lot of things, like they sort of what Kim was talking about, rumination, just thinking over and over situations, and maybe reading into situations a little bit more than what's actually there, feeling like they're being judged by somebody. Things like that are very common with teenagers especially.
Thank you. So with that, what are some of those unique signs about depression in children and in our adolescents? And Chris, if you want to go ahead and start this one.
Sure. A lot of times parents will tell me they just don't seem happy anymore. they're just so unhappy or down. They may not be sad. A lot of times with kids, it doesn't show like it does with adults. So they're not having crying spells sometimes, but it may be more irritability, it may be more just kind of being quiet and solemn, withdrawing from other people, just kind of sticking to themselves. And once again, there's sleep changes usually with that, and eating changes along with that too.
Yeah, I was going to add on to that too and say that we see, changes in weight. That's one of my most common questions in an intake is, has there been any major weight fluctuation in the last year? Because your diet and sleeping seems to be some of the biggest impacted things there. And then the other thing I see commonly with teenagers is that isolation where they want to quit activities. So they'll come in and tell me, I played soccer my whole life and I just don't like it anymore. It's not fun anymore. And so I hear that often.
I would also keep an eye out for, listen to their self-talk. What are they saying about themselves? How are they discussing themselves? Like, oh, I'm such a bad friend. Nobody really likes me. I hate how I look. I need to lose weight. So those kinds of self-esteem things can be an indication. Also, if they feel guilt for things that they didn't have control over, like, oh, if maybe I had never, if I was a better kid, you and dad wouldn't have gotten divorced or something like that. Like, obviously that had nothing to do with it. And then I also, I forgot what I was going to say, but I had something else. I don't remember it, but I will let you know if I do. But those are some of the other things.
Yeah.
Okay, thanks.
Jump in, absolutely. And anytime, if anybody wants to jump in with some more information, I'm more than happy to allow that. So, so speaking of depression, so you've been talking about a lot of symptomology that I find very similar between children and adults, teenagers and adults. So what would be some unique differences between the adults and Whitney, would you mind going first on this one?
Oh, sorry, I had myself muted. I think that children are just not, like we've said, are not as easily able to articulate how they feel. And so you're kind of looking for these other clues where an adult can come in and they can tell you that they feel a certain way and this is why they feel that way. A child, an adolescent, a teenager may not be able to articulate that. They may not even know why they feel the way that they do. So we're being detectives and we're looking for these clues that the kids are giving us that they don't even know that they are.
I remembered what I was going to say, and it actually goes with this. So yay for me. I think another thing is so once you reach adulthood, you've kind of reached most of your developmental stages, and you're not working on as much stuff as far as development goes when it comes to like Erickson, who kind of is the guru of development. So that's another thing we also have to weigh out is like, how much is this developmentally appropriate and how much of this is beyond development appropriateness? So like Chris mentioned, isolation. There's going to be an increase of that when it comes in like isolating from loved ones. There's going to be an increase of that of teenage years because they're starting to go out and want connection with their peers and not their family as much anymore. So that's not necessarily an indication of depression. So we also have to kind of weigh out like, how is this even more so past the developmental appropriate, which I think is why it can be harder for kids and teens because they're already kind of dealing with a bunch of stuff that we have to figure out. At adulthood, you've kind of gotten solidified. And so it's very clear when things are different than what's average expected. And so I think that's the thing is like looking for those outliers, looking for things that are a little bit different. Kids will usually show their feelings in big ways, and it's usually really unhelpful big ways. So that's the tantrums, that's the throwing things, that's saying mean things that you don't necessarily see as much as adults as you would with kids because kids are not knowledgeable of how to deal with their feelings because they have to learn it. And so like the kids with the big feelings are usually big indications that something's off, and it could be depression or anxiety.
So, in addition to what Kim's talking about, which is great, because we always have to kind of screen for, is this within the realm of developmentally appropriate behavior? You got to think about situational factors. So, say a child or a family moves to a new neighborhood, moves to a new school. Those are stressful events, even if they're going to be good in the long run. Those can precipitate some of these situations or some of the symptoms for anxiety and depression. Family situations that change, maybe a divorce, a separation, death of a family member or a pet, can be a triggering event as well. And obviously, situations such as like a traumatic situation, being in a car accident, some kind of abuse or neglect kind of situation, or a natural disaster, thinking about the Henryville tornadoes and how that just really affected so many in our community for such a long time. And some of the most vulnerable folks are our children and our teens, so they feel that stress as well as the rest of the community.
Yeah. Thank you all so much about that. And I just want to make sure that people that are joining us know that they can submit questions through the chat feature here. And we'll answer some of those here when we start wrapping up toward the end. So let me go on with the next question. Whitney, I'm going to start with you again. What are some of the common causes of anxiety and depression in young children?
Okay, so Chris just kind of touched on some of those, but we like to call those in mental health our ACEs, which stands for Adverse Childhood Experiences. And so some of those include trauma, being isolated, neglect, abuse, physical abuse, sexual abuse, emotional abuse. Another one is limited resources, so lack of resources, and not having things like things to eat, things to wear, all of your basics. Another one that I see often in young kids is that they feel different when they aren't understanding what's going on at school. So maybe we haven't identified yet that they might have a learning disability or need extra help. And so they are struggling. They know that they're different. They don't know why. And so they're starting to feel down on themselves.
Thank you. Anyone else?
I think another piece that's important to recognize is the genetics. So like if you have a family full of people who are anxious, there's a really good chance your kid is going to have anxiety. And some of that is nature, but also kids pick up on a lot of this stuff too. And so like we have seen many times that kids are very much kind of acting out their own parents' anxiety or depression in the sense of like their parents are nervous, so they get nervous, and they may not know why they're nervous, but they just feel it in the household. And so that also can be a thing of nurture. So they're learning it, they're seeing it, they feel the anxiety as well. And then also lots of changes, lots of chaos can increase the chances of anxiety and depression. So like, for example, parents, when they separate, sometimes they might do parenting time where it's 4 days here, 4 days there, 4 days here, 4 days there. That can be a lot for a kid, especially when they're really little, to kind of figure out like, who am I at and where am I with and what's going on, especially if the parenting styles are different. So like inconsistency in parenting styles can also increase chances of depression and anxiety, because how is the kid supposed to keep up with who expects what and where and how? It can be really overwhelming, especially for little kids and teenagers. Well, adults too. I mean, I don't do well with that either. So like, if I'm being honest.
Being off routine can also impact greatly. We are all creatures of habit, and kids and teenagers especially. So when we're out of sync out of routine, that is stressful on us physically, emotionally, mentally. And so when kids' sleep schedule gets sort of disrupted, maybe they're not eating like they used to, those can really impact them tremendously. And we saw just the impacts, still seeing the impact of COVID with the isolation and the change in major routines. And in some ways, I feel like we're still recovering from that, or still dealing with the effects of the pandemic on children and teens and adults.
Well, Chris, since you brushed on the subject about teens and adolescents, what are the common causes that, other than what you just mentioned, that you see in that population?
Some of it also goes into relationship issues with peers being such a big part of developmentally for teenagers, the importance of their peer group. And I know we'll probably touch on this later with the influence of social media, but there is so much that goes on now with feeling like the need to stay connected. And when teens are away from their phones, it really makes them feel isolated and can lead to feelings of anxiety and depression if it lasts long enough.
Thank you. Would any of the other panelists like to touch on that?
I would concur with Chris. I think majority of the time it is somehow relationship related, whether it's relationship with guardians, relationship with peers, relationships and dating. I think that is probably one of the biggest triggers to a lot of this that I see more than anything at the adolescent stage, which makes sense because developmentally that's who they're looking to understand themselves in the world, is their peers.
Absolutely.
I'll add one quick thing to that, and that's that commonly in that middle school range, we see a lot of bullying too. Also in high school and also in the little kids, but particularly middle school, I feel seems to be the absolute worst for bullying.
Yeah.
One more thing, I'm sorry.
No.
I also want to mention that there's also a significant increase in depression and anxiety for those kids who are kind of figuring out themselves when it comes to gender identity and sexuality as well. There is a higher risk of depression. There's a higher risk of suicidality among those in the LGBTQ plus community. Some of that is just kind of navigating that. Some of that is family, and some of that is peer, and some of that is society. So I think that's another piece that I think is really important for us to touch on, is those kids in the LGBTQ plus community definitely have a higher risk and a higher chance of having depression and anxiety as well.
Mm-hmm. And I can concur on all of this because I've been doing some studies recently, or been reviewing studies, and research in this area. And I've found in particular, and I don't have that in front of me at this moment, but I have found in particular that both what you, Whitney, and even what Chris was talking about, totally relevant. Even not just in the United States or this area, but across, any of our, any of the populations that have a high school, or a middle school type of concept. So, Kim, I'm going to go ahead and start with you on this one. So how can caregivers help when a child or an adolescent is struggling with anxiety?
What a great question. I love this question because there's a lot that parents can do, more than I think they sometimes feel. One of the first thing is if you yourself struggle with anxiety or depression, I put depression in there even though you only asked about anxiety. Talk to someone, get your own help, make sure you are doing okay, because one of the best things that parents and caregivers can do is be the calmest person in the room. I regularly say this as a therapist, I have to be the calmest in the room. And what I mean by that is when a kid becomes dysregulated by anxiety or any other emotion, they need someone to kind of mimic. And so in our brain, we have something called mirror neurons, and those mirror neurons are all about attunement and kind of like connecting with other people. And a lot of times this helps us mimic other people. And so if I become dysregulated, my child in front of me is going to dysregulate at the same rate I do. And so if I'm staying calm and I am the calmest one in the room, they will actually, regulate to me. It might take some time, it might be an hour, but they will eventually come down and regulate because I am staying calm. So staying calm is hands down the best thing a parent can do, whether that's keeping their tone in check, their face in check, their body language in check, like all of it has to be in check. Even if you think you're good at hiding that stuff or kids don't pick up on it, they absolutely do, because that's the mirror neurons. They're picking that up. Another thing is don't minimize it. Don't be like, oh, it's not a big deal. Quit worrying about it. Think positively. If that worked, I wouldn't have a job. Steve or any of us here would not have jobs because we would just tell kids to think better, think different. And then another thing is to also, this is kind of opposite. It sounds opposite. Don't feed the anxiety. So if a kid has anxiety and it makes them not want to go to school, it is not helpful to actually keep them home from school in an extended period of time. Anxiety grows to the space you give it. And so if you are not challenging your anxiety, it will get bigger. And one of the ways to challenge it is to face the things that make you feel anxious, help them cope with it, and then keep shrinking the anxiety a little bit more. So actually, like, giving in to the kids' anxiety actually is not therapeutic or beneficial. It actually makes it worse.
Thank you. Would anyone else like to add?
Kim, you said it great. I just want to add on. So for parents and guardians, you have such an awesome responsibility, and there is a balance here between supporting and prodding your child. So knowing when to support and when to prod, going back to what Kim said, all of us have a comfort zone, and anxiety has a tendency to take over our life, depression also. But anxiety kind of shrinks that comfort zone where this is the only area that we feel like we're comfortable. And for some kids, that becomes only at home, only around mom or dad, only in my room. And so part of the job for parents is that job of helping the child push that comfort zone back out, because we can't live with the comfort zone like this. You can't go to school, you can't go to work, you can't do those things that you really want to do, and don't let anxiety rule your life. But as I said before, with kids, there is a loss in their confidence that they can handle it. They feel like anxiety is too overwhelming. I can't control this. It's too big for me. And you as a parent can help by supporting and prodding to help them regain that confidence that they lost, and know that, hey, I'm still going to feel anxious at the end of the day, because anxiety is a normal feeling that all of us, no matter how small or how big, we all have that. But that doesn't mean that I can't learn to tolerate the uncomfortableness and not accommodate to that anxiety.
Thanks, Chris. So Chris, when do you feel like the best time to bring someone into your child or adolescent into for mental health treatment?
Well, obviously, if it's starting to cause problems at home, at school, you're noticing changes that aren't going away in a couple of days or a week or so, it might be good to just check that out with a mental health professional. Sometimes there's things that can be done at school just to do a quick check, or going to primary care doctor and kind of talking it over with them to see if it might be something that would warrant getting an intake assessment at a place like LifeSpring.
Well, speaking of that, Kim, can you tell us what how our caregivers, our teachers, our community members can make this referral to LifeSpring?
So we will need a caregiver, and they have to have custody, or a guardianship, a court order guardianship, or a DCS placement. So someone who has the rights that allow them to make medical decisions can go online to our website. There's a little drop down box where you can click intake paperwork, you fill that out, and within a couple days, usually it's no later than 3 business days, someone will be in contact with you. Here at the CFS office on Fridays, we have open access. So from 9 to 1, at 9 and 11 o'clock specifically, we have times to do intakes, and it's first come, first serve. So once you fill in that paperwork, you would be able to come to that next Friday and come in first come, first serve. That means you don't guarantee have an appointment, but you wouldn't have to wait as long to get in if you got a scheduled appointment. And so it's kind of gambling a little bit, but that's kind of how we make it to where anyone can come in regardless of their referral source. If you are hospital discharged, you get first priority, and you will be guaranteed to see the person a day that you show up. And then if you have a DCS referral or a juvenile probation referral, you'd also kind of jump the line, because those are higher risk kids. And so that's kind of how it works here at the Child and Family Services office.
Thank you for that. So, so when someone, when a caregiver or even the child that they're bringing in, like, gets into services, what can they expect when receiving mental health services here? And I'll let anybody answer.
Well, from the very start, you're going to get what we call a biopsychosocial assessment, which is a comprehensive assessment of the child. We're trying to, at this point, understand your particular child and your particular situation, because no two situations are alike, no two children are alike. So we want to take that time for an hour to talk with you, to talk with the child, to try to get a sense of what's going on. And from that point, we develop a treatment plan, which kind of lines out the options. And some of this depends on your insurance package, but outpatient therapy, where you would come to the office once every couple of weeks to do that, is an option for some insurances. Adding a case manager who does skills training can offer additional assistance in between the therapy appointments. Obviously, we try these two first before we go to the third step, which would be involving Whitney in a medical evaluation. We kind of take a conservative approach with medicines here in our department, that we want to rule out environmental, situational kind of factors. We want to try to work on coping skills and really give behavioral therapy a good go at it. And then if those issues persist after you've been coming for a while, then we would look at a medical evaluation. And that doesn't necessarily mean that the child will be placed on medicine, but options would be laid out, like this might be beneficial. So that's kind of some of the services that we offer here.
Well, going with that, you really led into the next section here, talking about medications. So Whitney, when are psychotropic medications needed, in your opinion, for all age groups?
Okay, so what I typically tell people when they come to see me is I am looking at functioning and how it's impacted your functioning. If it's significantly impacted 2 or more areas of your functioning, such as sleep, it's affected your appetite, your weight, your ability to enjoy things that you previously enjoyed, or, despite coping skills and therapy, you aren't progressing, as Chris said, that's when we start to talk about medication management.
So is there an age range or limit that you're looking for?
Yes. So I treat children 6 years old and up. We typically do not start medications before that. And like Chris said, we're very conservative here at Child and Family Services. We want to be really careful about when we use them and reserve that for only, situations where it's very much warranted.
So what are the most common concerns that you will hear about putting children or teens on psych medications?
The most common one I think that I get asked is people know about something called the black box warning for suicidal ideations with psychiatric meds. This is something that the Food and Drug Administration put out on almost all psychiatric meds, mostly our SSRIs, our antidepressants, and our antipsychotics. And this just means that anybody who starts a new psychiatric medication under 25 could have new suicidal thoughts. Now, this can be really scary for parents and sound really backwards compared to what they are coming in here to receive, which is a medication to help with these symptoms, right? So what I typically tell people is this is very rare. I want you to be aware of it. I want you to call me if it happens, but I've had less than a handful of children in my years of experience that have actually called and said that they had that occur.
So how long does it?
Can I
Go
just
ahead.
add real quick?
Yeah, absolutely.
So another thing that I hear as a therapist is if a family has a history of addiction, they will say, well, I don't want to go on medication because I don't want to be addicted to meds. And so, Whitney, please correct me if I'm wrong, but this is the spiel I get them and I hope it's right. A majority of what Whitney would ever prescribe are non-addictive medications. And so, your SSRIs are not getting you high. Your SSRIs are not going to be something that's addictive, as compared to other medications that they see out there. And so that's kind of what I do to reassure clients of like, listen, I get it. And that's not the medication you're getting put on. You're getting put on something that's non-addictive. Is that correct, Whitney? I hope so.
Absolutely. Yes. Yeah.
Well, so Whitney, whenever you go ahead, yeah, you have more to add.
Oh, no, I was just going to add a couple of other things that people have common concerns about, and that would just be weight gain. A lot of our teenagers are concerned about weight gain. And this can occur with psych meds. We have to get down to the specifics of which ones we're using. So that was another one I wanted to add. You can go on. I'm sorry. No,
that's super important, actually. So I kind of just wanted to get to kind of the social media part before we ran out of time here. So, but I do want to know, once you decide that somebody needs to be on medications, like what does that time limit look like?
Okay, so what I typically tell people is that when someone comes to be put on a medication, for instance, like an antidepressant, because they have generalized anxiety or major depressive disorder, the first time you go on medications, we are looking at a goal of about 6 months to a year. And this is my personal practice. I give that person long to work in therapy, work on coping skills, and then if we are stable and doing well, we can consider weaning off at that time. Now, when someone comes back to me a second or a third time for medication, then we're talking about, okay, is this something that we may need to take for the rest of our lives? Because we may be looking at less of a situational crisis and more of a chemical imbalance in the brain.
Well, thank you for that about the medications. I'm going to transition into talking about our social media because I would like to know, and I think the community would like to know, what role social media plays in childhood depression and anxiety. And Whitney, I'll just roll with you.
Oh man, that's a big one. Yeah, so that's honestly, it's become one of my intake questions for new patients is what type of social media are you consuming? Because I have learned that there is a branch of TikTok specifically for mental health. And unfortunately, this is where teens often get a lot of bad information. And so they come into me and they've already diagnosed themselves because TikTok has told them exactly what they have. And unfortunately, and fortunately, most of the time that's wrong.
Exactly. What are you seeing, Kim or Chris?
I know for me, people put on TikTok and all the other social medias, and let me start by saying, and I tell my teenagers this, I am not anti-social media. I see the benefit of it. I think there's really great things of being seen and heard in social media that I did not necessarily have when I was, a teenager, because all we had was MySpace, kind of, with dial-up internet. But so I'm not anti-social media, but I do think there's an importance to be smart about social media use. And so some of the things that I have seen is, we put our best life on social media. We use the best pictures with the best filter, with the best trips that we take. We're not talking about the argument maybe we had with our significant other or our parents or our sisters. We're not putting that out there. And so I think, you're getting snapshots of people's best lives. And so if you are not critically thinking about that when you're looking at social media, you may think everyone's happier but me. Everyone's life is better than mine. Everyone has all these cool things going on in their life but me. Everyone's dating but me. And so I think there's a lot of negative self-talk that can come from it. Plus also filters and camera angles. They're so bad because kids, a lot of teenagers will be like, well, I wish I could look like this. I'm like, that's not a real picture. That's not their real body. That's an angle. And so critical thinking when it comes to social media use is so vital. And I think it's really important that after, it's only until a certain age or after a certain age that kids can actually critically think. So a 7, 8, 9-year-old watching and looking at social media, they don't have the brain capacity, because this part of their brain is not functioning well, to really filter out effectively what's going on social media. And so I think it can do a lot of damage because they're not looking at it logically, they're looking at it emotionally.
Yeah. And some of that seems unattainable, So Chris, can you speak to maybe some of the positives? We've heard some of the negatives.
Yeah, there are positives to social media as far as for teens, especially staying connected with peers through different platforms. And this is a way that they can have friends with them all the time. And obviously that strength also can become a negative when they're losing sleep because they're up at 3:00 in the morning on their phone. So obviously limits need to be set around that. But that is one of the big positives, is that it does provide them a way of connecting. And obviously for those of us that did not grow up during this social media digital age, it may be kind of a foreign idea to us that our friendships primarily are through the internet and social media, but that's where this generation is. And I think we as parents and caregivers need to kind of understand that and know that when we restrict social media, that we are not only restricting their access to the phone there, but also to their access to their friends. So we have to do that very gingerly, very carefully.
I just want to add one other thing that I think is really important. So I grew up in rural Kentucky, and so finding people having similar interests that you might may not be possible in a smaller community or a community that has a very specific culture. And so I think social media also allows us to feel seen and heard about maybe interests that we don't necessarily find other people in our school system that likes it, but I can find someone on the internet who also likes this specific anime or this type of, music kind of thing. And so I think that allows them to feel connection that I didn't necessarily get, because all I had was my small high school and that was it. And so I think that's another piece that can be really helpful, especially among disadvantaged families and communities. So the LGBTQ community, you can find a lot of support online that maybe you can't in the high school because of maybe the culture that exists there.
Can you all speak more about some of the negative impacts of social media?
Well,
I
think a
will
lot of
say, sorry, Chris. You can go ahead.
I was just going to say what Kim was talking about earlier, that there's a tendency to kind of judge yourself against some image there on social media. It also kind of opens the door for more like cyberbullying types of situations to happen, where people will gang up on somebody, and you'll get like these group texts that go back and forth, and it almost seems to be like a never-ending cycle, some of the youth have told me, and just how damaging that is. And that really may tip somebody over from just having a little bit of anxiety to a whole lot, from being just a little bit depressed to being really depressed, for people that aren't suicidal to possibly thinking more about harming themselves or cutting themselves.
Yes, I was going to add to that I think, unfortunately, the thing that concerns me a lot is that people are talking to people in other places that they don't know, that they've never met in person. And so there can be predators there. I think I've heard a lot of teenagers that are talking to people in other countries, which is super exciting and endearing. But we have to be really careful, because sometimes those are not the people that they're portraying themselves to be.
Exactly. So, as a caregiver and even as a community member, how can we all balance these positives and negatives of social media with our kids?
I think having healthy boundaries around the social media, setting limits and restrictions. I don't think that means you have to absolutely hover over your child's phone at all times, but I think it is a good time to have a cutoff time so that it's not affecting their sleep. I always tell people, pick a bedtime, pick a wake up time. There's no phone or screens allowed into that space of time. So boundaries are good. And then checking in with them and making sure teens feel comfortable talking to parents. If they are uncomfortable talking to someone on the internet, or something has gone the wrong way, that they know that they can talk to you about it, and hopefully avoid those situations.
I think creating a safe place as a caregiver of like, I'm not going to come in and go, TikTok's the worst, I hate it, it's stupid, there's no point to it. So like if I'm villainizing social media, no teenager's going to come and talk to me about it, especially if there's something that's like concerning, because they're going to go, oh, Kim thinks I'm stupid for even being on this. And so I think that's the first thing. And then the second thing is really like having open conversations about internet safety, about like, how do you keep yourself safe? How do you make sure that this, you make sure that the person on the phone is the person that you know? Like, how can you make safe choices? And then if you do all those things and someone still puts you in harm, how do you feel safe enough to come to me? Because there's a lot of exploitation that can happen with like pictures and videos. I've had clients that are very intelligent and not impulsive, that have chosen to send pictures that were compromising, and then it get used against them, and then they feel so embarrassed to tell their parents because they're scared they're going to get in trouble. And so I think just kind of having those open conversations, those safe conversations, is really, really, really important. And then even just checking in, like, oh, who's your friend? Like, tell me about them. That's so exciting. Be interested in who they're talking to, not in an interrogation way, but in a like interested way. I want to know more about this person. That's so exciting that they love your anime kind of thing.
That's exactly what I was trying to say, Kim. you elaborated that so well. Yeah.
Right. So, it doesn't look like we got any questions in the chat. So do you all have any like final things to talk about before we wrap up?
Well, obviously, we're talking about anxiety and depression with kids and teens. And one of the assumptions that we've been going under with this is that kids do have anxiety and depression issues. And that may be a revelation for some folks. They may not think of kids in those terms, but it looks a little bit different for kids and teens than it might for adults. But those same issues pop up, and treatment can be very effective with these issues. And if you are concerned as a parent, as a guardian, as a community member, please reach out. That's what we're here for. We want to help. That's why we're here. That's part of our mission as LifeSpring, that we are here to serve this community, and we want to be that support for you. And we hopefully together as partners, we can help to try to figure out what's going on with your child and link them up with the best service.
Thanks, Chris.
And I think to add on to that, if you come here and you have an intake, we will tell you if we're like, we think this is okay. We think this is developmentally appropriate. Like, we don't just add everybody who comes in and go, oh, you're going to be here for a year. Like, I have had many therapists that have told parents, like, I understand your concern. I understand why you're worried. And right now it seems like everything's okay. Your kid is adjusting, even though they may feel sad sometimes. So like, we will provide that feedback to you if this is developmentally appropriate or not something that merits, you know, a diagnosis at the level of like major depression disorder. So I think that's also something to kind of know, like, we don't just keep people because they show up. Like, we'll let you know if it's okay. And we'll also, we'll also let you know when you're ready for discharge. So like, I very often have conversations of like, you're doing really well. You've made it without me for 2 months and you've been okay and you've been stable. And so like, we'll talk about completing treatment, and that happens pretty often here. I mean, that's not abnormal. That doesn't happen once in a blue moon. Like, we have these conversations where clients have done the work to be able to discharge, and I call it graduate from therapy, because they're doing so well.
Thank you, Kim. All right. So I would love to give a big thanks to our panelists for taking time out of their busy schedules to be with us tonight. And I'd like to also thank each of you all who tuned in. Your support is essential. So hopefully you'll tune into our next one in the future once it's scheduled. So feel free, if you want to hang out. If you have some questions you didn't want really to be recorded, that's fine. And thank you all for attending.
Thank you.